Hepatitis and Coinfections. What is coinfection? Coinfection is basically called as multiple infections presented by multiple pathogen species. It includes simultaneous infection of a single cell by two or more virus particles. For example, the coinfection of liver cells with hepatitis B virus and D virus. Hepatitis B and HIV coinfection. Hepatitis B is many times more infectious than HIV, and it can survive outside the body in dried blood for at least a week. People with HIV, and if they are living with hepatitis chronic carrier people, may have a higher risk of hepatitis-related complications. If you are infected with HIV and CHB, then this very sure to early diagnosis and treatment even more critical. HIV and HBV, both viruses are may be transmitted almost in the same way, like needle sharing, sexual contact, childbirth, from a birth parent, blood donating. Hepatitis C and HIV coinfection. People living with HIV and hepatitis C or B coinfection have a more rapid development to cirrhosis. Liver disease has developed the main cause of death among people living with HIV coinfected with either hepatitis B or hepatitis C. Hepatitis C coinfection with HIV-infected people is reported always at higher risk of HIV, especially among people who inject drugs or alcohol. This is because both viruses are spread through the sharing of non-sterile drug preparation and injecting equipment. Hepatitis B and D coinfection. Hepatitis D, also known as Delta virus, is a liver infection caused by the hepatitis D virus, HDV. Hepatitis D only occurs in people who are also infected with the hepatitis B virus. People can become infected with both hepatitis B and hepatitis D viruses any time, known as coinfection. However, there is no vaccine to prevent hepatitis D. If you have already infected in hepatitis D, then you can take hepatitis B vaccine to prevent this deadly coinfection. Hepatitis B and C coinfection. Hepatitis B virus, HBV, and hepatitis C virus, HCV, coinfection is common among people living with HIV infection, such as the exchange of blood or other body fluids during intravenous drug use, sexual contact, or mother-to-child transmission during the perinatal period. Such coinfection speeds up the liver disease and raises the illness and mortality in patients, particularly if left undiagnosed and not treated. Hepatitis B virus, HBV, and hepatitis C virus, HCV, coinfection is a complex clinical entity that has a projected worldwide occurrence of 1 to 15%. As per clinical studies, the progression of disease is faster in HBV-HCV coinfected patients compared to any single HBV or HCV infection. Any coinfection can the cause of higher rate of hepatocellular carcinoma development appears in the patient. Viral replication in coinfected cells is characterized by a dominance of HCV over HBV replication. There are no established guidelines for treatment of HBV-HCV coinfection. Studies on antiviral therapies and direct-acting antivirals have shown varying levels of efficacy. Clinical reports indicated that the treatment of HCV without suppression of HBV increases the risk for HBV repetition. Mother-to-baby transmission of hepatitis B or C is rare. However, the risks are very higher if the mother has already infected in HIV after that she got infected with any hepatitis B, C or D viral load. How to know that I have coinfections of HIV and hepatitis B or C? HBV coinfection is diagnosed by the detection of HBs AG or HBV DNA in the serum. The hepatitis B envelope antigen, HB-AG, may or may not be detectable and is not essential for diagnosis, but it is a valuable indicator of viral replication. If you like this video, please like and subscribe our channel. Please share with us in the comment box if you have any new tips or ideas about hepatitis B infection are welcome.